Biceps tendonitis is an overuse injury of the biceps muscle. So your biceps muscle runs from your shoulder down towards your elbow. It causes pain and inflammation, especially with activities such as lifting and carrying. So if you happen to notice when you're carrying groceries in the door and you feel some pain down the front side of the shoulder, or if you're putting the dishes away and you're kind of reaching up and forward and you feel pain that runs down the shoulder, the front side of the shoulder in particular, then you're probably dealing with biceps tendonitis. Welcome back to PT Time with Tim. I'm Dr. Tim, a licensed physical therapist, and I'm here to show you the best physical therapy stretches and exercises in order to treat and prevent common injuries. I often have patients come into the clinic that are thinking they have rotator cuff tendonitis, which typically produces pain on the outside of the shoulder, kind of the top and the outside, that kind of runs down the outside of the arm. However, whenever I kind of assess them, I figure out that they're actually dealing with biceps tendonitis. If you're not sure if you have biceps tendonitis, it's fairly easy to identify. So if you press in on the front side of the shoulder and you just kind of roll around that tendon that you may feel in there, that's your biceps tendon. You'll also feel it kind of stretch and contract whenever you're bending your elbow back and forth. So if you kind of dig around on it and you feel the reproduction of pain that you're feeling when you're lifting and carrying things, then that's pretty much saying that you've got biceps tendonitis. So my first warning with biceps tendonitis is stop doing any aggravating activities. You've got to stop anything that's causing pain. All too many times I've seen people continue to do those aggravating activities, and that will not help heal that tendon. So just stop doing anything that causes the pain. So the first thing that I want you to do is simply massage the muscle belly. So the muscle belly of the bicep is that big kind of Popeye looking bicep muscle that you have. And so if you just gently massage it, you're going to notice that there's a lot of tightness and there's a lot of tenderness in there. And that's because that pain and inflammation in the muscle and tendon unit there cause it to tighten up kind of protectively. So we just need to get it to relax to help improve the blood flow through there. So just gently massage it for a few minutes and just kind of work it out. So our first exercise is supine flexion with a stick. And basically you just need something that's lightweight, that's rigid at the same time. So a golf club works, a broomstick works, and a ski pole works really well. So you're gonna start with that at your hips and your hands are shoulder width apart. You're gonna take the non-painful hand. So I'll say my right arm is the non-painful side, my left arm is the painful side. So my right arm's gonna do all the work. My right arm is going to lift my left arm up overhead, and I'm going to stop at the onset of pain or stretch in that left arm. Pause there for 3 to 5 seconds, and then lower it back down. So again, my right arm is lifting my left arm up, finding that onset of pain or stretch, pausing for 3 to 5 seconds, lowering it back down. And what you should notice as the days go on is that you're able to reach kind of further and further or higher and higher before you hit the onset of pain. So that would be showing improvement with it. So our next exercise is going to be using a piece of resistance band. It's this flat resistance band, easy to find online. So you'll just get a small section of it, and it's called the dual external rotation. So grab it with an overhand grip about shoulder width apart. You're going to have both elbows tucked into your sides, so you've got a nice 90-degree bend at your elbows. Keep those elbows tucked to your sides, and then pull the band apart equally while simultaneously squeezing your shoulder blades together. So you're getting a workout in both the shoulders and those shoulder blades. So again, pull the band apart, squeeze the shoulder blades, and pause, and then relax. And you'll do that for 3 sets of 10. All right, our next exercise is a prone horizontal abduction. And basically you're going to lie on the edge of your couch or a bed or a table, and you can start with just your arm hanging down towards the ground. And we need to set the shoulder blade in the correct position to start, and sometimes people have difficulty with this, so make sure you get this first part right. What I have people do is I tell them to shrug their shoulder towards their ear, but then reverse that and take it all the way back down towards the butt. So we're starting from that kind of shoulder blade back and down position. So we're not leaving the shoulder blade up towards the ear, we're pulling it back and down. All right, so then once you get that down, keep your elbow straight, your palm facing the ground, you're going to extend the arm out away from you directly, squeezing that shoulder blade back and down, pausing, and then back down to the floor. So I can show you again. Keep the elbow straight, palm facing the floor, shoulder blade pulled back and down, pausing and back down to the floor. Now, if this one is too easy for you, you can grab a small light weight. This one's a 3-pounder, but you can also start with a 1 or 2, or even a small soup can works if you don't have any weights. So with the weight, it's the same thing. Keep that shoulder blade back and down, elbow extended, palm facing the floor, extending away from you, pausing, back down, and you'll do this for 3 sets of 10. Our next exercise is a prone shoulder extension. So this is just a little bit different movement. Again, setting the shoulder blade back and down, elbow straight, palm facing the floor. You're going to extend the arm down to your side this time, but simultaneously I'm going to roll my palm out away from me, so my thumb is now pointing towards the ceiling. This is going to give me a really good squeeze in that shoulder blade area. So again, palm facing the floor, shoulder blade back and down, rolling the palm out away from me, thumb to the sky, pausing, and back down. Again, with the weight, light weight, you can extend that same position and back down for 3 sets of 10. So our next exercise is going to use the same resistance band that we had earlier, except this time you're just going to curl. So if my left arm is the painful side for this one, I'm going to curl the right side up. I'm going to get a small a small space in between both hands, and then I'm going to extend my left elbow. So I'm extending it down and away from me while I'm holding up with the non-painful side. So I'm feeling the back side, the tricep muscle, I'm feeling that working on this one. So again, I'm holding the right side up and extending the left side down to my side, getting my left elbow completely straight, and then back up for 3 sets of 10. All right, so our next exercise is side-lying flexion. So I'm going to start with a light weight. This is a 3-pounder, but like I said before, a 1 or 2 will work. Also, a soup can would work. You can start with the weight directly at your side. Make sure that elbow's straight, shoulder blade down and back, just like all our other ones. And you're going to extend the weight forward in front of you, just to about shoulder height here. Now you can see that it's above my body, as well. So I'm not having this down super low. I'm keeping this up about, I don't know, 30 degrees or so above the body and back to the side. So it's almost like an arc movement. I'm bringing the weight in front of me and then back to my side. And you should feel this on the back side of the shoulder. We're working the posterior side, the back side of the shoulder here. So this is 3 sets of 10 for side-lying flexion. Our next stretch is a pec stretch. Your pec muscles are those chest muscles that you have right here in the front of your chest. So in order to do the stretch, you can either do it in a corner like I have here, or you can do it in a doorway. So you can use the door frames on a doorway. They both work perfectly fine. So whatever you have most easily available. I'm going to use the corner here. So I'm going to face the corner with 1 foot forward. Bring my arms up to a goalpost position so my elbows are shoulder height. And then I'm going to start to gently lean my chest forward towards the wall until I feel a moderate stretch across the front side of my chest. I'm going to hold for 1 minute, and then I'll relax after that minute. I'll do 2 repetitions in a row. So again, goalpost position, 1 foot forward, gently leaning forward until you feel that nice pec stretch across the front. Hold for 1 minute, 2 repetitions. Thanks for stopping by PT Time with Tim. You'll definitely want to go check out my other shoulder stretching and strengthening exercises as you advance along your pathway to living a pain-free, active, and adventurous lifestyle.